Hi there, this is Dr. Johnny Truong. I'm going to be talking to you about a condition called fibromyalgia. And this is a very debilitating condition that some of my patients come in with. Some have this condition for most of their life, and it's really debilitating. A lot of them are unable to work. They're unable to really do anything really because some of the main symptoms they have are widespread musculoskeletal pain. They have weakness. They feel tired all the time. So they have, it causes chronic fatigue, and it makes the person, who has this condition become very unmotivated in their life, and they have insomnia, and so that causes them to feel, that can translate to mood changes quite often, and it also just affects mental clarity. It can lead to brain fog, it can lead to all sorts of problems. It can lead to, I think I might have mentioned, memory loss as well. So this condition, like I said, is debilitating. It's something that actually will set people back. It causes them to be really disconnected from their life and their environment and the people around them. And it's something that we all don't want to have. Unfortunately, fibromyalgia is prevalent in a lot of women, and it's prevalent in our society. It's just certain degrees of it. But the ones that have it really bad, I mean, it just really takes them out of commission, and they're not able to work. They're not able to earn a living for themselves, and have to rely on other people to do that for them. And so what is fibromyalgia? Well, if you look at fibromyalgia, you break up the word fibromyalgia. Fibro is fibrous tissue. Myalgia is pain. So you put them together as, just pain of the fibrous tissue that's all over your body. Imagine, right? So fibrous tissue of the bone, the ligaments, the muscles, the tendon, all over your body is just in pain. And the precursor to pain is inflammation. So when you have fibromyalgia, it's like having inflammation all throughout your body. You imagine your body being on fire, right? That's fibromyalgia. And so your joints are just on fire, and it's just really difficult to move around with joint pain. It's difficult to move around with muscle pain, and that's what most fibromyalgia patients endure. And the inflammatory process doesn't get turned off, unfortunately, and a lot of my patients suffer with this condition for many, many years of their life, sometimes decades. And and they've gone through a lot of different specialists. They've seen acupuncturists, they've seen physical therapists, they've seen traditional chiropractic doctors, they've seen medical doctors. They've been on antidepressants, they've been on anti-inflammatory drugs, sometimes over the counter like ibuprofen, and then some are prescription opioids that are very harmful for their bodies. And really they get temporary results from those too, by the way. So when they come to my office, a lot of times I'm doctor number 18. I'm down the line, and so what I do that's different from most practitioners or specialists out there is I do a technique or method called the Blair upper cervical technique, and this particular technique focuses on the brainstem, which is the area where the brain connects with the body. So when you have trauma, a lot of times fibromyalgia, based on some of the research and some of the literature, a lot of the fibromyalgia patients come from situations or causes of fibromyalgia comes from traumatic events in their life. So right after a car accident, or maybe many years after a car accident, or some type of traumatic event from sports injuries, or falls, slip and falls. And what happens is the bone slips out of alignment in the upper neck area. The bone is called the atlas bone, slips out, and it causes nerve interference to this area, and it limits how the brain is able to connect with the body. So it causes this disconnect to occur. And the brainstem itself is known as a neurological pathway which regulates and controls inflammation in the body. So when there's interference to this area, your body doesn't handle inflammation very well, and thus the body is in an inflamed state for forever, unfortunately. And so what I do in my office is I assess for that when the patients come through, and I see if there is a misalignment. I'm able to take specific x-rays of the neck to see how that bone has slipped out of alignment, and then I realign that bone to allow this system to work again and to tone down the inflammation in the body. And a majority of my patients, with fibromyalgia, seem to do very well. They actually have really great outcomes. Their pain goes down, their inflammation goes down, they're able to sleep better, their mood improves, their energy is enhanced. And if you are suffering from fibromyalgia, I would love to at least offer you an opportunity to come in for a complimentary assessment to see if there's something that I can do for you. I'm not saying I can help you, but at the same time, it'll be a shame if this particular care could be a potential solution for what you're going through. And I get the frustration of going to specialist after specialist and really losing hope in finding an answer for your challenge. But I'd love to meet with you if you have this particular condition, and I'd love the opportunity to meet with you and do an assessment to see if there's something that I can do to help you out. Anyways, thank you so much for listening, and I hope you got something out of this video. And please pass the information along for those of you, the people that that might be suffering from this particular debilitating condition. Thank you so much.